Hi, I'm Charlotte Moser, co-director of the Vaccine Education Center at Children's Hospital, Philadelphia. Today on VEC Vaccine Notes, we're going to be talking about hepatitis B. Now, when many people think about hepatitis B, they think about the main ways that it's spread, through sex and injection drug use. And because of that, they wonder, why on earth do we need a birth dose of the hepatitis B vaccine for the newest babies? The realities are more complex than that. Certainly, sex and injection drug use are the two most common ways that this virus is spread. But hepatitis B is actually known as the silent epidemic. And that's because many people don't know that they are infected with hepatitis B. There are 3 points related to this. First, when children are infected with this virus, many times they don't have any symptoms. So they're not treated, they're not diagnosed, and they go on to become carriers for decades. Many adults don't know that they have this virus. They find out when they're diagnosed with liver disease. And so the third point is the combination of those two ideas, that many people don't know that they have this disease for many decades until they develop symptoms later in life. And it's during those intervening decades that people can unwittingly spread this virus to others simply because they don't know that they should be cautious when others come in contact with their blood. We're going to get into that a little bit more as we go along here today, so I hope you'll stay tuned for this important conversation. We're going to talk about the disease caused by hepatitis B virus, the vaccines we use to protect against it. We'll address some common questions we receive here at the Vaccine Education Center, and we'll finish up with a look at the relative risks and benefits. So let's get to it. Hepatitis B is a virus that infects the liver. There are 3 severe outcomes from a hepatitis B infection. First, hepatitis itself, which is generally speaking an inflammation of the liver. Cirrhosis, which is a condition in which the healthy tissue of the liver is replaced over time with scar tissue, and that scar tissue impedes the normal function of the liver. And liver cancer, which is also known as hepatocellular carcinoma. Each year in the United States, about 22,000 people get hepatitis B, and about 2,000 people die from their infections. So as I mentioned, there's some confusion around how hepatitis B spreads. At the heart of spread of this virus is the blood. People who are chronically infected with hepatitis B have large quantities of the virus in their blood. The quantities are so large, in fact, that they can spread the virus to someone even if the amount of blood the person is exposed to can't be seen with the naked eye. The second thing that makes this virus spread more easily or in ways that people don't realize it's being spread is that the virus is hardy. Most viruses die shortly after they leave the body, but hepatitis B virus can survive on surfaces for up to 7 days. So this combination of having large quantities of the virus in blood and being able to live on surfaces for up to 7 days means that people can be infected without even realizing they were in contact with someone's blood. I like to say this virus hides in plain sight for that reason. Some of the ways that people can be infected with hepatitis B virus and not even realize it are if they're exposed to quantities of blood that they can't see on items around the house that might have blood on them. Things like washcloths, toothbrushes, or razors. Things that people might have blood on, but then they don't realize it, and so somebody else comes along and is exposed to that person's blood. There have also been cases where people have gotten this virus because someone on their sports team has been infected with the virus. This most often occurs with teams that are contact sports, where there's an increased likelihood of coming in contact with another team member's blood. The virus has also been found to be spread when tattooing equipment isn't completely sterilized or when medical equipment isn't completely sterilized, including at places like wellness centers where there might be unseen quantities of blood on equipment that wasn't properly sterilized. Now, there are some groups of people who are known to be at higher risk for hepatitis B infections. This includes healthcare workers who are more likely to come into contact with someone's blood, injection drug users, particularly if they're sharing needles, newborns of mothers who are infected with the virus, and that typically happens during the birthing process when they're exposed to their mother's blood. Of course, as we mentioned, people can get this through sexual contact because the virus is in semen and vaginal fluids. The virus has also been found in saliva, but it's not thought to spread that way. And people can't get hepatitis B through air, food, or water. Now, you might be wondering, okay, fine, this is how this virus spreads, but that still doesn't explain why newborns are recommended to get a dose of this vaccine. So what we know is that about 18,000 children each year got hepatitis B virus before we had routine recommendations for vaccines. About half of those children were infected because their mothers had hepatitis B virus. So again, either during the birthing process or shortly thereafter if they're exposed to their mother's blood in some other way. But there were still about 9,000 children each year who didn't know how they got hepatitis B virus. Many never knew how they were infected with the virus. And this comes back to that more casual contact. So think about a relative who maybe has hepatitis B virus infection but doesn't realize it. Or the child's in daycare and another child bites them. Or they are exposed to a washcloth that has an unseen amount of blood on it. Or they chew on the same toy that has some blood dried on it from another child chewing on it. These things didn't happen very often, but they still happened. And so when we had a hepatitis B vaccine, the very first vaccine recommendations did in fact specifically target those high-risk groups that I mentioned. And that was around in the early 1980s when those recommendations evolved. But within 10 years, what they realized was that there was no change in the rates of hepatitis B by targeting those high-risk groups. Now, some of that was due to the fact that some of those groups are difficult to find. It's even more difficult to make sure that some of those groups get all 3 doses of a 3-dose vaccine. But that wasn't all of it. There were still people who were getting infected that weren't in these high-risk groups. And so in the early 1990s, the recommendations changed to routinely vaccinate all young children. Since that time, we've seen the amounts of hepatitis B infections drop dramatically, particularly amongst those children who are old enough to have been in those groups that were routinely recommended to get the vaccine starting at birth. If we keep vaccinating these babies and children over time, within a generation or two, we could potentially eliminate this virus. If you want to take a deeper dive into the information about how hepatitis B vaccine recommendations evolved in the United States, we have an article that we link to from the Hepatitis B webpage. It was published in our Parents Pack newsletter. The article also goes over some of the recommendations for hepatitis B vaccine throughout the world, and it also goes through more details about transmission of this virus. The Parents Pack newsletter is a free monthly email that we send out so that people can stay abreast of the latest information on vaccines. You can either subscribe by going to vaccine.chop.edu/parents, or you can check the show notes. So before we move on, I wanted to just talk about a couple of facts related to this virus. Hepatitis B virus is actually about 100 times more infectious than HIV, that's human immunodeficiency virus. And part of that is likely because of these large quantities of the virus particles in a person's blood. It's estimated that someone who's chronically infected with hepatitis B has about 1 billion, that's billion with a B, particles of virus in 1 milliliter of blood. And just for context, a milliliter is about 1/5 of a teaspoon. It's estimated by the World Health Organization that about 1 in every 32 people throughout the world are infected with hepatitis B virus. Only about 1 in 10 of those people know they're infected, and only about 3 of 100 actually get treatment. Now, in the United States, it seems that more people know they're infected, but it's only still about 50% of people with chronic infection who know they actually have that infection. So again, it's one of those details that makes it easier to understand why this virus can hide in plain sight. People just don't know that they're infected with this virus. About half of the liver cancer diagnoses in the United States are caused by hepatitis B infections. And it's estimated that about 5% of the deaths of people with cancer in the United States are caused by liver cancer. Now, the World Health Organization does recommend hepatitis B vaccination for all infants and young children, and they estimate that about 8 of every 10 children throughout the world receive all 3 doses of this vaccine. So let's talk about the vaccine. When hepatitis B virus reproduces in our liver, it produces an excess amount of a protein that we can call hepatitis B surface antigen. It's against this protein that we need to be protected in order to be protected against hepatitis B virus. So what scientists did was they took the gene for hepatitis B surface antigen and they put it into yeast cells. And as the yeast cells reproduce in the lab, they make this protein, which is then purified and used as the vaccine. Now, there was an earlier version of hepatitis B vaccine where the excess protein that was made by an infection was isolated from the blood of infected individuals. The sample was then treated to theoretically kill any viruses that might have been in the person's blood. But when the HIV epidemic started in the 1980s, it made people very nervous to be taking blood from an infected person and hoping that we were killing all of the viruses that were in that blood, including HIV. So the vaccine wasn't really used that much, and it eventually was abandoned. Once genetic engineering came along, then Dr. Hilleman, who's the scientist who worked on this vaccine, realized that we could take the gene for hepatitis B surface antigen, put it into cells in the lab, and make the vaccine that way. So the way that the hepatitis B vaccine is made today, there is no chance for it to be contaminated with any other viruses. The hepatitis B vaccine was the first vaccine to prevent cancer. And as I mentioned, Dr. Hilleman was the person who created this vaccine. There's a documentary about Dr. Hilleman's accomplishments called Hilleman, A Perilous Quest to Save the World's Children. We have a link to the clip of the film that's related to making hepatitis B vaccine on our webpage at vaccine.chop.edu. So who should get this vaccine? There are 3 groups we can talk about here. So first, as we've already talked about, infants and young children are recommended to get this vaccine routinely. Infants should get the vaccine within 24 hours of birth so that if they are inadvertently exposed to hepatitis B virus, either in the hospital or shortly after leaving the hospital, the vaccine should still be able to help protect them against getting chronically infected with this virus. They get 2 additional doses, one at 1 to 2 months of age, and then another between 6 and 18 months of age. The second group of people are those up to 60 years of age who haven't previously been vaccinated. And the idea here is that as increasing numbers of children have been vaccinated against hepatitis B, older adults who hadn't had the vaccine as children will be the remaining susceptible population. So by getting the vaccine, they can protect themselves against the virus, particularly since we know viruses survive by finding susceptible people to infect. The third group are people that are 60 years and older, specifically those with high-risk conditions, but also anybody 60 and older who would like to protect themselves against this virus who hasn't previously been vaccinated. Now, when we talk about the side effects of hepatitis B vaccine, they're similar to other vaccines. Pain and redness at the injection site for some people, and maybe a low-grade fever. Now, people who get the hepatitis B vaccine can also experience anaphylaxis, which is a severe allergic reaction to a vaccine. That kind of a response happens very quickly after vaccination. And in reality, it can happen after receipt of any vaccine. It's just a very rare side effect. We mention it when we talk about hepatitis B vaccine because it's a little bit more frequent after this vaccine compared with other vaccines. It occurs after about 1 of every 600,000 doses. So as the recommendation for any vaccine, you should just stay at the place where the vaccine was administered for 15 to 30 minutes after getting vaccinated, so that should anaphylaxis occur, there are healthcare personnel there to help with that response. So now let's go over some common questions we receive here at the Vaccine Education Center related to hepatitis B virus and the vaccine. Again, one of the most common questions we get relates to that birth dose of hepatitis B vaccine. And we've talked a lot about that already, so I won't repeat a lot of that. I'll just say, again, to highlight some of the main points. Each year before this vaccine was routinely recommended for children, about 9,000 children would get hepatitis B virus infections. As Dr. Offit, our director, likes to say, it's virtually impossible to be careful enough to avoid this virus. And that's because of those large quantities of virus in an infected person's blood and the fact that many of them don't know they're chronically infected. In this section of our website, we do have a link to a video of Dr. Offit talking about the birth dose of hepatitis B vaccine. And we provide another link to that Parents Pack article that we mentioned earlier. So again, you can review the information related to transmission, as well as the evolution of vaccine recommendations in the United States and vaccine recommendations around the world. Sometimes people contact us and they want to know if they're a teenager or an adult that hasn't had the hepatitis B vaccine, should they get it? And again, as we talked about, a lot of people never know that they're exposed, that they're chronically infected, or how they were exposed. So if you want to protect yourself against this virus, then it does make sense to go ahead and get vaccinated against hepatitis B if you weren't previously vaccinated. Sometimes we get questions about whether an extra dose of hepatitis B vaccine is harmful. And this stems from the fact that because of combination vaccines that are available for use during infancy and early childhood, some children will get an extra dose of hepatitis B vaccine. The answer to the question is no. Generally speaking, extra doses of vaccines aren't harmful. If you think about it, we're likely exposed to viruses and bacteria that we protect against with vaccines when we're moving about our community, and we simply don't know we had those extra exposures because we have immunity from vaccination or previous infection in some cases. And so our immune system just takes care of that exposure. We don't get sick and we never even know it happened. So an extra dose of vaccine is similar to that. Our immune system will recognize the virus in the vaccine, or in this case, the protein from the vaccine, realize that it's foreign and address it without us having any issues. The difference when we get an extra dose of vaccine is that we know it happened. When we come upon these viruses and bacteria in the environment, we often don't know that they happened. Some people don't respond to the hepatitis B vaccine, and so we'll get questions from these individuals who are considered non-responders, oftentimes healthcare workers who didn't respond to the vaccine, asking what they should do. Now, there are protocols for this, and usually your healthcare provider can help. So if you find yourself in this category, definitely talk to your healthcare provider. But just for a general overview, to give you some context for this situation, the two older vaccines for hepatitis B were 3-dose vaccines. And people 40 and older didn't always generate protective immunity after getting those vaccines. Usually about 75 of 100 people would be protected after 2 doses. And after 3 doses, that number would move up to about 90 out of 100 people. But that still left about 10 of every 100 people not protected against hepatitis B, even after having received 3 doses of the vaccine. So historically, what people would do would be recommended to get another 3 doses of the vaccine for a total of 6 doses. And in many cases, those people would then respond. But in 2018, a new hepatitis B vaccine called Hepatitis B became available. And that only requires 2 doses. But the significant change to Hepatitis B was that it now includes a different adjuvant so that people have better immune responses. So typically now 90 to 100 of every 100 people respond with a protective immune response regardless of their age when they get that vaccine. There are 3 other notes related to this question. First, there were always some children and adults younger than 40 who didn't respond to the traditional hepatitis B vaccines. Usually it was about 5 of every 100. In those cases, those people would be recommended to get a second series, so another 2 to 3 doses of the vaccines. Historically, the 3-dose vaccines, now that Hepatitis B is available, 2 doses. But it's important to note that children under 18 years of age cannot get Hepatitis B, so they would need those 3 doses. And finally, if somebody finds that they are a non-responder, even after having received 2 series, so that means 5 or 6 doses of hepatitis B vaccine total, those non-responders are recommended to just take extra precautions to try to limit the chance that they get exposed to this virus. And one thing to note is that after that many doses, even if it's not a measurable immune response, they probably still have some immunity. So hopefully that would be sufficient to keep them from becoming chronically infected should they be exposed to this virus. Some people wonder if hepatitis B can be eradicated. Now, eradication means removed from infecting anybody anywhere on Earth. The only time we've ever done that successfully is against smallpox. In order to be eradicated, a virus can't infect other animals. It can only infect humans. And in the case of hepatitis B virus, it can infect some other animals. So it would be difficult to eradicate hepatitis B. That being said, we could potentially eliminate hepatitis B. Now, in public health terms, elimination means that we've removed that virus from a particular geographic area. We've eliminated viruses like measles and polio and rubella from the United States in the past. And so we could theoretically also eliminate hepatitis B with a strong immunization program. It would take time to eliminate this virus, however, because as mentioned, a lot of people don't realize they're chronically infected, so this virus can hide in plain sight, and it's virtually impossible to be careful enough to avoid the virus. So the way that we would eliminate hepatitis B is through a continued strong immunization program, so that as the children who are being immunized routinely during childhood become adults, there will be fewer and fewer people who are chronically infected and therefore less of a chance to inadvertently spread this virus to other people. Sometimes people ask whether there are treatments for hepatitis B virus. Now, it's important to note that most people who get a hepatitis B infection will recover and they'll be fine without any treatment. But for people who are chronically infected, this becomes a different story. There are some antiviral medications that chronically infected people can take, but there are some limitations. First, the treatment would be long, meaning months, or even ongoing, meaning lifelong. And second, these treatments could prolong life by limiting liver damage, but they can't cure the virus. There are clinical trials with newer types of treatments, antiviral treatments that are ongoing, and so hopefully at some point we'll have some new tools to help us treat people who have chronic hepatitis B infections. There's one other time that antivirals tend to be used, and that's during pregnancy when a woman is chronically infected with hepatitis B virus. Now, normally women are tested for hepatitis B during pregnancy. Those tests aren't perfect, which is, again, one of those reasons that we have infants who are susceptible at birth. But in the case of a woman who's positive for hepatitis B, her infant would be treated immediately after birth in 2 ways. The child would be vaccinated, and the child would receive immunoglobulin, which is an antibody treatment to protect it against hepatitis B infection. If a woman has hepatitis B infection and she has a very large quantity of the virus in her blood, even with those 2 treatments, some babies would go on to develop chronic hepatitis B infections. So if the woman is tested prior to delivery and the levels of virus in her blood are known to be high, sometimes the provider will suggest that she take antiviral medication in the months leading up to delivery as a way of decreasing the amount of virus in her blood, so that when the baby's born and receives that vaccination and the medication, the immunoglobulin medication, they have a better chance for success in fending off that virus. Okay, so let's finish up with a quick look at the relative risks and benefits. Today we talked about the fact that each year in the United States, about 2,000 people die from infections with hepatitis B virus, and that about 22,000 people are infected with this virus every year. We also talked about the fact that Many people don't know they're infected, which means they can spread the virus unwittingly to others. When children are infected, many of them never have symptoms, so they don't know they had the infection, they don't receive treatment. And both children and adults who have chronic infections with hepatitis B virus can go on to develop liver disease in the form of cirrhosis, which is scarring of the liver tissue, or liver cancer. When we look at vaccine-preventable diseases, other than COVID-19 and influenza, hepatitis B causes the most severe disease and death among the vaccine-preventable diseases. On the other hand, the vaccine has minimal side effects, pain and redness at the injection site, maybe a low-grade fever. Now, there is that a little bit more common cause of anaphylaxis, about 1 in every 600,000 doses. But again, if you remain at the site of where the vaccine was given for 15 to 30 minutes, these reactions happen very quickly, and so medical care would still be available to help with that. When our team evaluated the relative risks and benefits of this disease and the vaccine, we felt that vaccination was the safer choice. And we hope that as you review all of this information and consider the choice for your family, you'll feel that way too. Thanks for listening today.